If you would tell me who I am, at least take the trouble to discover what I have been.
I have a dream that one day this nation will rise up, live out the true meaning of its creed. So even though we face the difficulties of today and tomorrow, I still have a dream.
Dr. Daniel Hale Williams was the first person to successfully operate on the human heart. He is the father of black surgery. His medical innovation in heart surgery in 1893 paved the way for modern advances and techniques currently used by surgeons worldwide. However, in many modern medical history books, his name and his accomplishments are missing. Dr. Williams succeeded during an era when many whites, and even some blacks, didn't believe a hospital serving the needs of black people was needed. Against tremendous obstacles, his determination and talent established the foundation for quality black medical care to move forward on. For years, operations on the human heart were not performed by doctors because of the great risk to a person's life. That was until 1893, when a black doctor made medical history by performing the first successful operation on the human heart.
Dr. Hale Williams, back in 1893, had performed the first cardiac operation in the United States and possibly in the world, as far as the records show.
Daniel Williams was born January 18, 1856, in Hollidaysburg, Pennsylvania. He was the fifth child of Sarah Price Williams and Daniel Williams, Jr. His father was a barber and owned real estate, which made it possible to provide his family a comfortable middle-class lifestyle. During Daniel's childhood, his father was very active in the struggle for black rights and traveled heavily for a major civil rights group named the National Equal Rights League. When Dan was 11, his father got sick on one of his many trips and later died from consumption, now known as tuberculosis. His mother fought to keep the family from splitting, but without the financial help from her husband, she had to send her children to live with friends and relatives in different parts of the country. After a short time in Baltimore, Daniel moved to Janesville, Wisconsin with his sister, Sally. He learned how to cut hair from his father and used his skill to find a job as a barber. At the age of 17, Williams had to work to support himself, and this made it hard for him to return to school. Throughout his ordeal to make it on his own, he never forgot his father's advice to learn all he could. Gradually, his income grew at the barbershop, and he went back to school. When Williams was 21, he graduated from high school and remained at the barbershop because he still did not know what career he wanted to pursue. Over the next 3 years, he struggled to graduate from medical school and become a doctor. Without the support of a close friend who treated him like his son, things would have been a lot more difficult. This person found Williams a job the summer before he started his first year so he could pay his expenses. In medical school, Williams viewed diseases through a microscope for the first time and decided to specialize in surgical medicine. In Dr. Palmer's office, they had to rely on their own experience to diagnose illnesses, which made detection far more difficult. His financial situation failed to get better, and in his last year of school, it seemed like it would finally overwhelm him. But he survived from the help of the same person who found him a job before his first year of medical school. This generous individual took out a bank loan so that Williams could pay for his living expenses and complete his final year. This made it possible for him to continue volunteer work at a local hospital and continue sharpening his skills. Daniel Hale Williams graduated from Chicago Medical College in Chicago, 1883. Now renamed Northwestern University Medical School. During a time when there were no training schools for black nurses or internships at hospitals to train black doctors, he was the only black person in the medical school. After graduation, Williams received his clinical training at Mercy Hospital, a large Catholic institution affiliated with Chicago Medical College. In medical school, Williams made friends with numerous white classmates, and they continued their association after graduation. Within only 3 years after medical school, Williams and his white classmates had risen to the top of medicine in Chicago. By 1890, Dr. Williams was 34 years old, and after 7 years, he had built a solid reputation in his own medical practice. Despite his early success, like other members of his race, he faced prejudice. Segregation prevented him from admitting his black patients into white hospitals. During this period, Freedman's Hospital in Washington, D.C. was the only black hospital in the United States. Doctors had to operate in kitchens, basements, or wherever they could. He wanted to change these horrible health conditions and stop needless deaths and injuries.
The health situation or the health status in the black community was critical. Sanitation was an issue. Public works, as one might imagine, were not available in many instances. Access to medications, to physicians themselves, very poor. And during that time, many of the things that we take for granted today that can be treated with penicillin or another medication killed people. People were dying from pneumonia. They were dying from routine infections. Scarlet fever and other infections were the cause for much of the death that occurred in the urban areas at that time. And so Dr. Williams was aware of these statistics, and he was aware of the great need that existed in the black community.
Dr. Williams could have turned his back on this crisis like many did, and taken the easier road and passed as a white man because of his light skin color for better opportunities. He decided not to take this path, and in 1888 began planning to start a hospital for blacks. His first step was to find major supporters. When he went to influential black and white friends for backing, many told him they were not interested. The Provident Hospital project met with fierce opposition. We were accused of attempting to isolate ourselves, of drawing the color line. And a preacher went to the door of the modest cause of his wrath and left his curse and the hope that it would burn to the ground before the dawn of another day. Dr. Williams drew inspiration from different places. One source came from the writings of an English doctor who was one of the first to study comparative anatomy in England.
In 1888, he was named to the State Board of Health, the medical board in the state of Illinois. And from that position, he was able to garner the support of many people, both in politics and in business, religious leaders, to focus on the need for a hospital that could provide services for both black patients and white patients.
After 2 years, his persistence won backing of enough powerful people of both races to form a hospital association. The association bought a small building at 29th Street and Dearborn in Chicago. In 1891, at the age of 37, Dr. Williams made history when he opened the first hospital in the United States for blacks in Chicago, that he named Provident Hospital.
He took the name Provident Hospital from the concept of the Lord will provide, thinking about this, and he was a very religious man too. And so this whole idea of having a facility where black people could obtain the health care services that they needed so desperately at that time was something that he worked day and night to do.
His hospitals treated all patients, regardless of race. When the facility started, it made history for being the first hospital owned and managed by blacks in the nation. During the hospital's early years, he battled to hold on to his dream for quality health care for blacks. Along with the tremendous challenge to find enough money, he and his first intern had to do all the cleaning. To ensure that sanitation was adequate, they scrubbed down the floors and the walls of the operating rooms at the end of each day at night.
Found in the Provident Hospital suddenly opened up a whole world of opportunities for blacks to be physicians, to be nurses, and also black patients could go to a place where they could be treated with dignity and respect and compassion. So those were, very remarkable contributions of Dr. Williams.
Another hurdle was finding qualified black doctors. There were no training facilities, which meant they did not have the basic skills. As a result, he rejected large numbers. One doctor he turned away retaliated by contacting his influential friends who knew board members at Provident. The board forced Dr. Williams to allow the doctor to join the staff. Dr. Williams spent most of his time managing the hospital, but he also had to stay on top of the latest medical developments. He read European medical journals, enrolled in courses, and attended lectures. While in medical school, he decided to specialize in surgery. During this period, surgery was extremely dangerous. It was such a risk that most doctors would not cut into a patient because it caused infections about 90% of the time. These infections usually resulted in deaths. Another hindrance was there were no x-rays to prepare surgeons for what they would find in the body, and no heart-lung machines to keep the blood circulating during surgery. Infection prevention drugs like penicillin had not been discovered, and when blood was lost in surgery, there were no transfusions to replace it. Despite these issues, Dr. Williams was confident that surgery could still be done safely from his extensive study of anatomy and his case studies of medical history. At Provident, patients were offered various services, and one was treatment for medical emergencies. 2 years after opening, a young man was admitted after suffering severe injuries.
At the time, a young man had been stabbed with a knife and presented to Dr. Williams' hospital, and since his clinical condition had continued to deteriorate, Dr. Williams had to decide to operate on this patient contrary to the teaching and to the norm in the medical community at that time that cardiac wounds were not to be tampered with. He proceeded in opening the patient's chest, opening the pericardial sac lining of the heart, and discovered that the patient had a stab wound. This is a model of the head, and I will point to the region of the stab wound according to the description in his operative records. it showed about a half a centimeter or half an inch stab wound, about 2 centimeters from the right coronary artery, right around this region, which he repaired and closed the pericardium successfully, with the patient subsequently surviving and outliving Dr. Williams. So this was a major breakthrough, pioneering effort in the field of cardiac surgery, and for the first time confirmed that the human heart can indeed be operated on without any adverse consequences.
At stake was not only the patient's life, but the hospital's future. Dr. Williams was aware that if his patient died as a direct result of his surgical procedure, the public would probably turn against him and his hospital and force him to close.
When you go into an unknown area, you have unforeseen difficulties. To approach the heart in those days, if you go through the pleural space, the space that has the lungs would collapse as soon as they're exposed to atmospheric pressure. And in those days, the endotracheal tube that we use nowadays to keep the lungs inflated when the chest is open wasn't invented until 1914 by a Canadian surgeon. And the information on that wasn't widely disseminated really until the 1940s and 50s in even parts of Europe. So he had to deal with that problem. He was a well-schooled student of anatomy, and he approached it through what is called the bare area of the heart. And that's an area where the heart can be reached without going into either of the spaces that contain the lungs. Right here in the front of the chest, you have to take out part of a cartilage. So he understood that, and he understood how to open the pericardium. And also he understood good judgment. When he exposed the wound, he realized that it was not necessary, perhaps even meddlesome, to place a stitch in it, because the sutures that he had, the needles of that period, were very much like the needles we used to sew a button on, but even perhaps more crude. They had an eye, which was a widened part of the needle, like on a regular button sewing needle, and a piece of string that was threaded through that eye, and the hole that the needle made, because of the widened part of the eye, was actually bigger than the main body of the needle, and tends to start more bleeding. So he exercised judgment in not putting a stitch in.
After the major newspaper in Chicago ran a news article about his incredible operation, the hospital's reputation improved, and Dr. Williams suddenly climbed into national prominence. Dr. Williams' daring rocked the medical profession, and he injected it with the confidence that safe operations on the human heart could be performed. By the end of 1893, Providence was in its third year and had grown to a 12-bed facility. With the hospital running well, Dr. Williams turned his attention to the plight of black nurses and opened the first nursing school in history to train black nurses at Providence.
There were not many institutions that would provide higher education for blacks in any field, much less in the medical field. And so he envisioned having this hospital also serve as a training ground for black nurses and black physicians. And so the nursing program started in 1891 and stayed in existence for some 75 years. And all from that kernel, that vision that he had to provide opportunities for blacks where previously there were none.
The next year in February, his renown in medicine was a major factor in being offered an appointment from the new president, Grover Cleveland, to be surgeon-in-chief at Freedman's Hospital in Washington, D.C. He accepted the position, but after he was accidentally shot in the leg hunting with friends, he had to delay his arrival. After months of rehabilitation, he won the battle to save his leg from amputation. In the fall of 1894, at the age of 38, Dr. Williams took over as head of Freedman's. Of immediate concern to him was the hospital's alarmingly high death rate. There were other issues too. He had to quickly adjust to a much larger facility that had 200 beds. Friedman's old wooden building was falling apart. Patients going into surgery were wheeled from one building to another in any weather. They even had to leave the hospital to eat meals, and patients who were too ill to travel off grounds were delivered cold food. Patients were bunched together haphazardly, not by illness, and they had to do what little cleaning that was done. The way nurses handed out medicine was to call out the time every hour, and patients had to dose themselves, regardless of their condition. General sanitation procedures were not strictly followed. In operations, staff wore ordinary clothes with no mask and rubber gloves. Another problem he had to work around was the tight federal budget that made it tough on him to obtain the kind of funding, buy equipment, and hire staff. Despite these pressing concerns, Dr. Williams was committed to making improvements. Another measure he implemented was to group staff in buildings into departments. Patients were grouped according to their illnesses. He placed surgery patients in the building where the operating room was. He also instituted modern techniques for examining specimens and tissue samples. This gave doctors as much information as possible about a patient before starting treatment. He raised quality even higher by bringing in an interracial staff of 20 of the city's top doctors to serve as consultants without salary. This offered black doctors their first opportunity to work in a hospital. Dr. Williams also created the first internship program to train doctors at Friedman's, and this strengthened his staff. His innovation again led to the foundation for black medical school graduates to receive the necessary training.
He was aware of the problem of access for black physicians, because there were some black physicians even during that period, and they had a difficult time practicing medicine because they did not have access to the facilities to practice their craft. Many physicians could not get on the staffs at various hospitals, and indeed Dr. Williams experienced this himself.
Dr. Williams realized black nurses needed a facility for training and established a training school at Friedman's. Before Dr. Williams took over, the hospital served only low-income black patients. He wanted to attract the black middle class to strengthen Friedman's image. By inviting the public to watch him and other surgeons perform demonstration operations for students, gradually, blacks with higher incomes gained confidence in Friedman's and used its services. There were other periods when Dr. Williams got overwhelmed by the burdens of organizing the hospital. During one of these times, he visited black leader Frederick Douglass for advice. Douglass was his mother's cousin. "My boy, you say you see what ought to be done. Well, hoping will do no good, now or any time. There is only one way you can succeed, Dan, and this is to override the obstacles in your way by the power that is within you. My boy, do what you hope to do." Frederick Douglass. In classes that Dr. Williams taught, medical students and doctors were amazed at his skill. Dr. Williams' reputation stretched throughout the city, and even white doctors visited Friedman's to study his methods so they could learn.
Dr. Williams was a trauma surgeon in addition to being a very fine thoracic surgeon. Back in the 1890s, many of the principles of trauma surgery that we take for granted today were not known. Even exploring the abdomen for abdominal injuries was not a basic principle widely accepted in this country. Dr. Williams managed a patient who was stabbed to the thoraco-abdominal area, the back actually, involving both the chest and the abdomen. And he inserted a tube to drain the chest and then opened the abdomen and explored the abdomen. And he found that there was bleeding internally coming from the spleen. The spleen is a solid organ that helps our bodies to prevent infection because it produces those cells that help to fight off infection. And it's an important organ, but one can live without the spleen if it's damaged severely. At this time, Dr. Williams brought the spleen up into the field of operation, looked at it, and saw that he could repair it. And he used sutures to repair the spleen, and then wrapped it in a fatty apron called omentum, and then placed it back into the abdomen. Now, this procedure today is referred to as a splenography. It's very fancy. It basically means repair of the spleen. And it is an accepted principle today. And in fact, most of the injuries to the spleen we would hope we could fix. But that was not an accepted principle back in that time. And so here's a man who actually invented an operation that is quite contemporary today, but was revolutionary at that time.
Although white doctors in the District of Columbia Medical Society often discuss Williams' cases, they never invited him to join or even visit. In response to this, in 1895, he helped form two medical associations for black and white members. One of these organizations was the National Negro Medical Association of Physicians, Surgeons, Dentists, and Pharmacists. This has grown into the National Medical Association.
He had to overcome a lot of obstacles as a black physician at that time to go through what he went through, go through medical school and practice and succeed the way he did. So I think he really was a driving force in the black medical community.
During his years in Washington, Dr. Williams went through rough times away from the hospital. Frederick Douglass died in February 1895. Dr. Henry Palmer, who got him started in medicine, died. His brother Price, a prominent lawyer in Philadelphia, also died. In 1896, at the age of 40, he married Alice Johnson in Washington. After 2 years, the struggle to raise standards in an atmosphere of constant political turmoil had taken its toll on him. By now, he was convinced the federal government was not committed to funding Freedmen's so that it could be a quality facility for blacks. His accomplishment at Freedmen's disturbed some people to the point that they made secret plans to replace him. Dr. Williams was notified that he had to testify before a congressional hearing committee to defend himself against allegations of improper use of hospital funds. At the hearing, he thoroughly reviewed his record and was later cleared of all charges. After 4 years, he had reached his goal to transform the hospital into a quality facility and submitted his resignation.
You heard the terms quality control and quality improvement, and these are buzzwords today. But these were the things that Dr. Williams emphasized back in 1894. That's when he was the surgeon-in-chief at Freedmen's Hospital. So that's tremendous. Over 100 years ago, emphasizing the issues of quality care.
In April 1898, Dr. Williams went back to the same city where he had carved a place for himself in medical history, when he performed the first successful operation on the human heart 5 years earlier. Within months after returning to Chicago, he was called back to Washington to appear before another congressional committee. This time on charges he bought personal items with the hospital's money. Dr. Williams was shocked after he found out that the people he'd worked closely with on his staff, and even helped him to develop their careers, played critical roles in having these charges leveled against him. This betrayal from the people he was a mentor to hurt him deeply. After this, Dr. Williams did not hire an assistant in his office for many years, not even a secretary. The next year after moving back to Chicago, his hopes of starting a family ended when his wife lost the baby and almost died. This prevented her from having children. He suffered another traumatic loss the next year when his mother died. To ease his pain, Dr. Williams returned to Providence as chief surgeon. The facility he founded had expanded into a 65-bed hospital and was in a new building. It had been reorganized so that committees of the board and staff members ran day-to-day functions. The same doctor he rejected earlier, that he was forced to hire, was now an influential member of the board and on many committees. Dr. Williams also rejoined the medical association he enjoyed participating in before he left for Freedman's. Other hospitals sought his expertise. By 1900, he was caring for black and white patients on staffs in 5 hospitals. As his reputation for being an outstanding surgeon grew nationally, he was contacted by black doctors eager to learn. They paid his travel expenses to visit them in rural areas to operate on their difficult cases. Since there was not a hospital, Dr. Williams operated any place he could. News of his strong commitment to improve black medical care reached the South, and Meharry Medical College in Nashville, Tennessee, offered him a position to teach surgery and demonstrate operations.
He went to Meharry. He held a series of clinics, teaching clinics, to instruct medical students and other physicians in the surgical techniques that he had developed. He was a clinical professor of surgery at Meharry and held weekly clinics for a period of time. So he understood that institution building was a very important part of trying to address the healthcare needs in the South.
In Meharry's operating room, Dr. Williams performed 6 to 8 operations a day by lamp and candlelight. He knew this was inadequate and that blacks in Nashville needed a hospital. It could also be a place for training black interns and nurses. During this period, segregation prevented blacks from entering white hospitals in the South.
This is during the time of Reconstruction and beyond, not very many years after that phase. Remember, the Civil War stopped in 1865, Reconstruction after that. 1880s, the Northern troops were withdrawn from the South. That was around the time of the Hayes-Tilden Compromise. And subsequent to that, all of the Jim Crow, sharecropping, and other issues were developed to help to maintain slavery, but in another form. And so you can imagine that the health problems that black people faced during that time were just awesome. The infections that I mentioned, the poor sanitary conditions, the lack of access to physicians. Bear in mind, this is many years ago, but bear in mind that even during slavery, there was a syndrome, a clinical syndrome that was written up in the medical text called drapetomania. It was actually felt that slaves were sick if they wanted to run away. And so runaway slaves were diagnosed as having an illness, a clinical illness. And so that's the legacy, that kind of puts it into perspective. That's the legacy from which Southern blacks had to contend after the Civil War and after Reconstruction. So things were very tough, very, very tough. But in spite of that, there were many blacks, men and women, who worked very hard to address some of these needs. Dr. Williams was one.
January 23, 1900, Dr. Williams spoke at a public meeting in Nashville. You can and should at once establish a hospital and training school for nurses in this city. Nashville is noted for its educational institutions, its cultured people, its wealth, its beautiful homes, its medical institutions, and the number and capability of its physicians and surgeons. Start at once this educational and humanitarian work. Every city in the South with a population of 10,000 colored people should have a hospital and training school. A hospital of 25 beds, properly managed, is almost self-supporting. You will have many things discouraging with which to contend with at the start. Chief of all is lack of confidence in each other. This has always been a deterrent element in our race relations. The ignorant and naturally suspicious will have to be gradually induced to relinquish their unquestioning faith in the infallible skill and judgment of the white man. On the other hand, we must demonstrate our right to confidence. We must not be satisfied with erudition. We must have knowledge. Do not be deterred by the thought of antagonism. Few enterprises, even those having for their objective the betterment of mankind, have smooth sailing from the start.
There's no question that the people who have helped to start medicine, meaning Africans, have helped to build pyramids, meaning Africans, have helped to introduce various herbs and other drugs that are healing drugs, Africans, that these people are just as competent, just as brilliant as any other people on the face of the earth. But during slavery, that thought was not given credence. In fact, just the opposite. We were told that we were subhuman, that we were no better than cattle, and we were treated as such. And so what Dr. Williams understood was that as a people, we would have to provide for our own in terms of health care if we were to ever break or destroy that myth that had been developed during those slavery times.
By 1900, his campaign in the South led to the formation of 12 hospitals, owned and controlled by blacks. From Dr. Williams' initiative, for the first time, black nurses and interns in the South had a place to get training. They could also find jobs there.
He was a pioneer in developing institutions where blacks who had the ability and the interest to become physicians or nurses were able to achieve that dream.
In 1908, at the age of 52, a banquet was held for him in salute of his 25th year in medicine. Doctors from all over the nation sent greetings and gifts, except the doctor he rejected at Providence. Almost 4 years later, Dr. Williams shattered another racial barrier when St. Luke's Hospital, one of Chicago's best white hospitals, hired him as associate attending surgeon.
He was not allowed initially onto the medical staffs of many of the clinics in Chicago, but subsequently that changed and he was given some opportunities because of his tremendous skill.
His old enemy at Providence attacked him with charges of selling out the black race. The doctor even persuaded the hospital's board to notify Dr. Williams to bring all his patients to Providence. Without a response, Dr. Williams resigned and cut all association with the hospital he had devoted 20 years of his life to. He continued his work at Meharry and at other black medical and teaching facilities, and at St. Luke's. In 1913, when the American College of Surgeons was founded, he was admitted as its only black charter member. Blacks in all aspects of medicine owe a great deal to Dr. Williams, because whatever opportunities they have come directly from the foundation he laid. The history of hospitals owned and controlled by colored people do not show a single failure in their effort. Our white friends cannot do for us what we can do for ourselves. Dependency on the part of the Negro has always proved a detriment. When we have learned to do well what we have the ability to do, we will have accomplished much towards changing sentiments now against us. Dr. Daniel Hale Williams. In 1920, after almost 38 years in medicine, Dr. Williams ended his career and moved to northern Michigan to live in the summer and retirement home he built for him and his wife, Alice. Soon after, his wife developed Parkinson's disease, and spent the next 4 years in a wheelchair. She died in 1924. 2 years later, Dr. Williams suffered a stroke. Over the next 5 years, he had a series of strokes that impaired his mental skills and limited his movement. Aside from his niece, who cared for him, and occasional visits from his old friends, he spent much of his time alone. He never regained full strength.
He was a visionary and was way ahead of his time. In addition to performing the first successful surgery of the heart, there were other achievements that he had also done at the time. So he was way ahead of his time.
I consider Daniel Hale Williams part of my identity because I'm black, I'm a cardiac surgeon, and I'm part of that historical tradition and that historical problem. Many of the problems and sort of problems that he had, I've had in my career. Not with the same technical problems because the technology moved on, but with other technical problems. And the institutional problems he had, I've had similar problems. History is a critical part of it.
Dr. Williams died in August of 1931 at the age of 75. He did not have enormous wealth. In his will, he left gifts to Howard Medical College, Meharry Medical College, and a proposed interracial hospital in Chicago. Dr. Williams' largest gift was to the National Association for the Advancement of Colored People.
Trauma surgeon, heart surgeon, educator, organizer, just a tremendous person.